take a look at some x-rays of patients that we've seen very recently who have come in. They attempted all-on-4 procedures, and here you can see is a patient who has had 4 implants, lost 2, now only has 2 left. And so by losing those 2 implants that were in the upper anterior or the front of the upper jaw, that bone needs to be regenerated. So losing those implants is a big deal because now we have to go back in and regenerate bone. I'm going to have to remove these 2 implants because of bone loss around them. Also, I like to start with a clean slate. You know, they have some issues and I don't want to build a new foundation on old implants or implants that have already issues. Not to mention the implant here, they probably just attempted a sinus lift, not an augmentation, and so ultimately it would fail. I would not trust this back implant to build a new fixed zirconia prosthesis. So again, patient, he was doing his best, doing the best he could, you know, felt good about the doctor, but ultimately not too many years down the road, the entire case has failed and he's got bone loss, he's lost implants, and then now he's lost the prosthesis. So it's starting over. So here's another case. I don't know if you can see this x-ray very well, but also the doctor attempted all-on-4 on the lower. She lost 1 implant, so then he decided that he had to put her just in a denture, so he put some locator or some snap-in attachments on the remaining 3 implants. And about a year or so later, 2 of those implants fractured, so the entire implant fractured. So now she's got 1 implant that really is not doing anything, so she's wearing a denture. So let's take a look at how we problem solved this case. So this case, I've got 3 implants that need to be extracted. And removing implants is not an easy thing. You know, they do integrate with the bone. Now sometimes, you know, if an implant has bone loss halfway down the implant, even those sometimes are hard to remove. So that integration process is a real thing. And any doctors out there that have had to remove implants can understand that you cannot just extract an implant like you would a natural tooth. And I can show some video of actually removing these implants and how much force it takes and the technique that I use in order to remove those implants. I hate to even say it because I don't want to have to remove implants. That shouldn't be anything that we have to do, but here at Trust Implants we have found that we've had to remove a lot of implants because of bone loss, because of fracture, because of failure, and whatever the case may be. We've become very good at removing old implants that are no longer viable for a solid foundation that will last the patient the rest of their life. So let's take a look at this case and see exactly what we did. So here are it's just an image of those 4 implants. These 2 are fractured. This one is still okay, but it's not going to do me much good. So I went ahead and I just took out all 3 because there's some bone loss around this implant. So we went ahead and we removed all 3 of those implants. And here you can see we used a trephine burr, and you can see the bone is still attached. You know, we literally have to use what's called a trephine where we remove the bone around the implant. There's absolutely no way I could just pull these implants out. They have to be, the bone has to be taken away, like cord out, so that I can remove these implants. It's literally impossible to just try to reverse torque them out or try to extract them out. There's no way that you can do that other than utilizing a trephine burr to remove the implant. So here you can see I've got my 3 implants now removed, but let's take a look at the x-ray of her case after implants have been removed. I have 6 solid implants in good bone supporting and you know, the most distal implants. My AP spread on this case it's probably about 20 millimeters. So the reason I say that is because the original doctor, had he had some understanding of implant surgery, prosthodontics, he never would have ended up in that situation where he had 4 implants concentrated in the symphysis and the anterior mandible, the lower front jaw, and have had so many issues with fractures of implants. If he had some background in training, this situation never would have happened. And so as a doctor or as a patient, if a doctor is providing these implant services or a patient considering them, it's very important that you go to somebody who has the ability, is trained, has background, is training, university-based training, not just weekend course training. And so, had we seen this patient originally, this situation never would have happened because we would have done the proper thing using good quality materials from the beginning. And she lost a lot of time. It took, however many months to go through the procedure, and then a year and a half later, everything failed, and now she's back to having to redo the whole thing. So here's another case, all on 6, upper and low. Well, she's lost a few implants through the process. So she's got 5 implants left on the upper, all of which have bone loss, and she's got 6 implants on the lower, super concentrated in the front of the lower jaw, the anterior mandible, and the symphysis area, all of which have 5 to 7 millimeters of bone loss. And at first, when I looked at this case, I thought, oh, maybe we can extract these implants without having to use a trephine, because on some of them, I only have like 3-4 millimeters of the implant left in bone. But even still, even with, the majority of the implant is outside the bone, it's not embedded in bone. I only have a few millimeters of implant left in bone. And even those, like when I was talking about the trephine, even those I had to use a trephine burr to get them out. You cannot just extract them. They don't come out that easily. But ultimately, we did get everything out. We did get those implants out. And we were able to, on the top, when I extracted those upper implants, we just had to regenerate the bone and do a bone graft. And then on the bottom, we went ahead and placed new implants. But my point is this, these patients tried, they sought out treatment. They knew that implants were the right thing for them. They did not want to wear dentures. They didn't want to be like their friends or grandma or whoever that had to take their teeth out at night. They want something permanent. And that's really the nature of patients today. Do not want dentures. They want implants. And so those patients who are seeking these treatments and do want implants, it's critically important that you find a doctor that knows what they're doing, that can show you their cases, that have results, and that can truly deliver on the results and on the end product that they're promising you. Again, like I've said in many of my videos, you don't know until it's over, until it's finished. You have no idea what it looks like, what it feels like after you eat, until the case is done. And so that's why here at Trust Implants, we try to do everything we can to mimic nature, make the prosthesis as small as it possibly can be, yet still strong enough to handle the loads and the load that our mouth puts on it. And also having sufficient number of implants in order to support that load. And we call that, again, like I say in all my videos, it's over-engineering. We engineer for success. We over-engineer so that we have a parachute, so we have something to fall back onto. Because, we are working on the body, and the body is very dynamic. And so we want to over-engineer these cases so that we have patients who are happy with the end result and can be pleased with the investment that they've made. So in looking at the patient who we had to remove all these implants, so using the trephine and removing the bone around each implant, and you have to, it's a very technique sensitive procedure as well, because there are different diameters of trephine burrs, and you want to try to minimize the amount of bone that you remove and maximize the available bone that you have. So it's very technique sensitive to do the procedure. So we went ahead and trephine, removed all the implants, and you can see here they are. Implants are out. But then let's look at her x-ray after we had put the implants in. And so now the implants are out, but she has nice, long, nice, full-bodied, high-quality implants that will last her, if maintained properly, for the rest of her life. This requires planning. It requires knowledge of the anatomy and the landmarks. It requires understanding of the bone and bone physiology. So there's a lot that goes into this, and it's not, which is why the cost can be high. It is an investment. You know, if you're shopping around and just looking for the best price, you may end up with situations like this where you might get implants. You probably will, but you may also end up in a situation where those implants are now, you know, sitting outside the mouth or sitting on a piece of gauze. But you may also end up in a situation where the implants end up here and they're now have to be removed. So utilizing, and I can tell, you know, these are cheap implants. They're probably $80 to $100 a piece. The length wasn't correct. There are so many factors here that I see, and you know, and not that that's such a big deal, but it's the patient that is affected in this. And this patient just was so upset because she tried. I mean, she truly tried to do the right thing, and now she's having to go through the entire thing all over again. So my advice is to really consider, if you're considering this procedure, if you're considering having your teeth replaced, using however many number of implants, make sure and do your research. Make sure you understand what you're getting, because it's such a wonderful procedure. It's a surgical procedure. It's an aesthetic procedure. It's an artistic procedure. It's a biomechanical procedure. And you know, that's a big responsibility for the doctor to be able to handle and manage all of that at once. And with the all-on-4 and with these corporate all-on-4 centers, you're just simply not getting that. You're not getting the very best thing for you as a patient. I'm Dr. John Willardson. Today we've been discussing the replacement of missing teeth, all-on-4, and the benefits of the procedure, as well as some of the things to look out for. Thanks for watching, and follow us on YouTube at Trust Implants.